As the number of global cases surpasses 2.6 million, the World Health Organization warns the coronavirus will be with us for a long time. Hello, I'm Arnold Naidu, and this is The Heat. The head of the WHO, Tedros Ghebreyesus, says there are worrying upward trends in Africa, Central and South America, and is calling on all countries to remain vigilant. The United States has the most cases of any country, with more than 846,000 confirmed cases and some 46,000 deaths. U.S. President Donald Trump signed an executive order barring new immigration for people seeking permanent resident cards or green cards for the next 60 days. Trump says the action will protect unemployed Americans. For more now on the U.S. immigration policies, let's bring in our panel. Joining us from Washington, D.C. via Skype is Rafael Bernal. He's a staff writer with the U.S. political newspaper The Hill. Also with us from Dallas, Texas is Merrill Matthews. He's a resident scholar with the Institute for Policy Innovation. And Ina Tangen is a political and economic affairs commentator. He joins us from Beijing. Rafael, let me start with you. President Trump has signed this executive order which temporarily suspends immigration into the United States. Let's listen to part of what the president had to say.
By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad. We must first take care of the American worker.
So, Rafael, this action by the president has been condemned by immigration groups. What do you read into it? Why now?
Well, it's really political in nature and we know this for two reasons. We know it because immigration right now of new people coming into the country, which is the category that the president seems to be focusing on, is at a standstill so long as consulates abroad are not taking interviews. If you can't do your interview, you can't get a visa to enter the United States. It's that easy. Last month, for instance, there were, I believe, a total of 92 immigrant visas approved from China. And usually you're in the thousands every month. So we know on that end it's not big. The second side is, yes, there might be an ideological positioning behind it, because if they don't remove this pause after 60 days, if they decide similar to like the Muslim ban or the poorly named Muslim ban that was supposed to go on for 90 days and has been going on for substantially longer, if they don't remove that, that is good campaign fodder for Trump's base. And finally, I mean, frankly, there's just no evidence that immigrants, particularly green card immigrants, have ever taken away American jobs. They grow the economy by having more people and more consumers in a consumer-based economy.
Merrill Matthews, what do you make of this? Is the president playing politics with immigration laws here? The ACLU, the American Civil Liberties Union, has accused the president of using the pandemic to, quote, advance his racism and xenophobia.
Well, of course, I don't think it's necessarily racism because it applies to everybody. But I agree with the previous comments. I think that's mostly correct. I would add perhaps one more thing, and I'm not sure that this is the case, but the president has been trying to do things that he feels like provides a bit of an optimistic tone out there, something to help people feel like they're going to be able to come back and regain their status. As is pointed out, this doesn't affect many people, I don't think, but you've got an awful lot. You've got millions of Americans who've lost their jobs. Those tend to be in lower income service sector jobs and so forth. So there may be a hint of trying to say, well, the president's doing this, so that means there's a better chance I will be able to get a job when the economy opens back up. I don't know that that's necessarily the case, that they have a better chance, but I think that's trying to send a positive message out there.
But Merrill, to what extent is this about politics? As Rafael pointed out, many people who come here seeking green cards come here not to take other people's jobs, but to expand the economy.
Oh, I think that's absolutely right. But the president's never really been in, never really believed that. He's got some warring factions there in the administration. He's got Larry Kudlow, his chief economic advisor, who's very much a pro-immigrant person and always has been. Then you've got Stephen Miller, who's very much an anti-immigrant person. And so it seems to me he's trying to thread the needle a little bit. And what we've heard is that perhaps Jared Kushner stepped in and perhaps open this up a little more so that laborers, agricultural laborers, healthcare workers, and so forth, it exempts them. So it's not affecting an awful lot of people, as was pointed out, but it may be sending, as I said, in a sense of somebody who says, I'm stuck here at home, I've lost my job, will I ever be able to get back to work? And maybe there's a helpful message there.
All right, let's go to Ina Tangle and look at the situation in China. Ina, the rate of new domestic coronavirus infections in China has gone down to 0. And how is the country handling its reopening, and especially with a lot of foreign workers returning to the country?
Well, it's very cautious. I live in a district which was actually one of the few red zones. As a young student came back and was out visiting his friends, and that became a hot spot. So people, not only did the government say be more cautious, but I noticed immediately in my district there are fewer people on the roads and walking around than there had been in the previous week. So, I mean, people are still very aware that this is a very serious situation. They're taking it that way, and I think it's going fairly well to this point. You don't see people going out for lunch. The roads are pretty quiet during the hours, but in the morning and in the evening, we are back to rush hour as usual.
So, Ina, when you say people are very aware, do you still see people taking precautions like wearing masks and practicing social distancing?
Oh, absolutely. I mean, everybody wears a mask. That has become de rigueur. It's almost part of social acceptability. If you're not wearing a mask, people will actually look at you. If there's anybody around from, like one of the housing units, they'll say, hey, listen, to be safe, wear a mask. I really haven't seen anybody who hasn't worn a mask in the last, I don't know, more than 60 days. So it's part of that. In terms of social distancing, absolutely. I mean, if I go to a restaurant that could house 45 people, you're down to only 15 are allowed in. You can only sit 3 at a long table, and you cannot have anybody sitting directly across from each other. I mean, the government has done the geometry. They've decided that these are the high-risk areas, but the restaurants are open. So, and you can still get a haircut. They're very, very cautious there. You wear a mask, they wear a mask. They're spraying sanitizer on everything from the scissors to the comb. It's very, very thorough. So people have adjusted to this, quote, new reality. And if it, in fact, is going to be here for a while, I think there will be a good chance that China will weather it better than countries where people say that they don't have, the government doesn't have the right to pen them in.
Right. Rafael, I want to get back to the President's executive order on immigration. The Migration Policy Institute points out that immigrants are providing essential services right now at this time, often at great risk, while the country is being ravaged by this virus. And in many cases, they are on the front lines. They're healthcare workers, they're doctors, they're nurses, they perform all kinds of duties on the front lines. And I'm wondering, what kind of consequences will the President's executive order have?
Well, for that group of workers, there are specific carve-outs, and there's also a carve-out for not siblings, I'm sorry, for spouses or children of U.S. citizens. So those people can still get green cards. The one part, and we've still yet to analyze fully the executive order because it came out minutes before we went on the air. The one part that lawyers are very worried about is whether it makes a distinction for people who are already in the country and seeking to change their status from a temporary status to a permanent status, and people who are outside the country. Now, if it's 60 days and people outside the country are the ones who are blocked, everybody thinks it's something that can be weathered. If it goes on longer, then you start having a strange backlog and you start having problems. But say for the first 60 days, if you have people who need to change status who are in country and cannot do so, you might have people who are here legally, who've done everything right according to U.S. law, and are suddenly dumped out of the system, can no longer hold their job. They might have to leave the country, and it's doubtful whether they can leave the country. So that creates a lot of problems, and that will create, if that's the case, that will create a lot of litigation. But we have to go deep into the order itself. The White House report on the order, it didn't make that distinction, and that's a distinction that lawyers have been very concerned about for the past 2 days.
Meryl, lots of people talking about the reopening of the economy here in the United States. We had one state in the South, Georgia, where the governor there announced that he wanted to reopen certain categories of businesses by this Friday and other categories by next Monday. But in fact, President Trump said at his news conference just a few minutes ago that he actually called that governor and said that he didn't agree, that it wasn't the time for this to happen right now. It's too premature. It's too early. Are some states putting business concerns before science?
Well, Texas, where I live, the governor has started some changes last Monday. Today's Wednesday. They're supposed to be able to start doing elective surgeries and some other medical procedures today. I think that's absolutely right. And they're going to try to take a slow as you go process to see if things are to see how things are developing. As was pointed out from Beijing, they're keeping the social distancing, and they're doing some mask shaming. I think you'll see some of that going on here in the U.S. even as we begin to open up and start filtering back in. But there is a huge downside to not having an economy open, and it hurts the lowest income people the most. And there's, especially among sort of the more conservative Republican pro-economic people, a sense of let's try to get this economy back open again, just to be able to make sure that people are able to get back to work and start. I think it'd be slow going, but that's what we want to do.
I know, I want to get to this point in the few minutes we have left, and that is that there appears to be a campaign here in the United States, and it comes from both the left and the right. It's a bipartisan campaign to vilify China, to place huge question marks over China's initial response to the coronavirus outbreak. We have one state in the United States now, Missouri, the state of Missouri, which says that it's going to sue China for losses that the state incurred because of the spread of the virus. And we've been told subsequently that actually this lawsuit has no legal basis. There isn't much basis for it. But how is this being looked at in China?
Well, quite frankly, it looks like a racist dog whistle that Trump is using to kind of pull his base together as they face very difficult times. If you start looking at the electoral map and where people are really suffering, a lot of it is in Trump country. So he needs something that says, "Oh, look, I'm doing something. I'm being strong." But even this act that we're talking about has so many holes in it. It's like a Swiss cheese. I mean, immigrant visa, no immigrant visas legally, but certain H-1B for professionals, and also H-2A for guest workers, basically people who work in Trump's hotels and on farms. Those are allowed. So it's going to be a real question legally whether this goes through. From the Chinese perspective, it just seems like day after day, at least every other day, there is another attack on China, whether it's through an organization like the WHO insisting there's some sort of collusion. Interesting that Donald Trump likes to use that word when it's applied to others, or just directly. And even this act itself sounds a lot like the Exclusion Act of the 1800s, where Chinese were barred from the U.S. This has all the kind of racist overtones. Yes, the fact that it applies to everybody doesn't make it less racist, because it is being used in that way to get the electorate energized.
Rafael, very quickly, I've got less than a minute. You work on Capitol Hill. U.S. Congress has passed this relief bill that will help small businesses as well as provide funding for hospitals and for coronavirus funding. But there's been some concern that this is a transfer of wealth to the rich. Are those valid?
Well, I mean, there's always a lot of space for corruption when there's so much money moving. There's no oversight because this is all so fast. But there has been some misuse already. I think we can expect stories on the good, feel-good end, and stories that will enrage people in the future.
Right.
And we can't forget about the Against Wall Street movement after 2008.
Right. Okay, and that's where we have to leave it. Rafael Bernal, Merrill Matthews, and Anna Tangen, thanks to all of you for joining us. Health officials say the coronavirus doesn't discriminate based on race or ethnicity, but blacks and Latinos in the United States are being infected at a higher rate as essential workers. Earlier, I spoke with Dr. Uche Blackstock, the founder and CEO of Advancing Health Equity, and Stella Russ, an associate professor at the University of Maryland. Stella Russ, Uche Blackstock, thanks for joining us. Stella, let me start with you. We are seeing a disproportionate number of African Americans and Latinos in the United States being infected with coronavirus and dying from COVID-19. Why this huge disparity?
I think it goes back to the institutional barriers and instructions that there are for minorities in this country, starting with the healthcare system and healthcare access. And it's just pronounced in a pandemic. When structural barriers are in place, they're pushed even further in this kind of crisis.
When you talk about structural barriers, Stella, what are these barriers?
So it has to do with access to healthcare and affordable healthcare. Starts there. It also has to do with good paying jobs, wealth accumulation, having a good enough income to be able to afford to live in places where there is better healthcare, where there is better education. So they all work together, and having these barriers in place during this pandemic is really highlighting how it's disproportionately affecting minorities.
Right, and Stella, and to what extent does housing also affect the number of infections that we're seeing?
Yeah, housing has a lot to do with it, not only where minorities can afford to live because of the wealth disparity, but also that they tend to live in areas of high concentration of people. And of course, when you're dealing with a pandemic, that creates significant liabilities to contract the virus. So that all works together to make the situation for minorities even worse.
Right. Dr. Uche Blackstock, you work at an urgent care clinic in New York. There was a report in the British newspaper, The Guardian, which said that Latinos are being infected at up to 3 times the rate of white Americans. What are you seeing at the clinic?
So, I've been working in this urgent care for several months, but over the last 4 to 5 weeks, I've definitely seen a shift in the racial and socioeconomic demographic of our patients. Typically, we've seen very diverse racially patient population, but of the last few weeks, we've seen predominantly Black and Brown patients who have been coming in with COVID-19 symptoms. Many of them are essential workers and as well as service workers. So these are people who are exposed to the public. They are not able to have the luxury of working remotely from home.
And in most instances, do you find that they are covered for this, or are they not?
In terms of insurance?
Yes.
Some of them, in New York City, we have a pretty good insurance system, even for people who are low income. But I also am seeing a good number of patients coming in who are uninsured and who at our front desk will ask about the cost of being seen and the cost of being tested. And so obviously, there are concerns because that is a barrier to accessing care.
Stella, there's another dimension to this, and that in the United States, there are 10 to 12 million undocumented immigrants living here. I mean, how likely are they to seek help, given that the immigration enforcement authorities in the United States, forces like ICE, have been acting very aggressively against Latinos?
Yeah, I think they're much less likely to seek treatment or to hesitate to seek treatment, and to seek treatment when it could really be very helpful and not wait until it becomes a dire circumstance. That is one of the circumstances at play when it comes to Latinos, the high number of undocumented immigrants in the country and the step up in immigration enforcement under the Trump administration, I think creates even a more difficult situation for that population during this pandemic.
And Stella, are you also finding that in some instances people are getting to you a little too late?
Getting to seek medical care too late?
Yes.
Yes, of course. I think that's part of it, right? So if you're concerned about your immigration status or being met at a healthcare facility by ICE officials who may deport you, or even being turned in, even though that a lot of large cities have said that that's not the case and that they're protected, a lot of undocumented immigrants do not know that. And so I think they are waiting until the absolute last minute when they don't have a choice or when they think they're not going to get better on their own to seek medical treatment.
Dr. Blackstock, we are also seeing disparities in access to test kits. I mean, we know from reading in the newspapers, on the internet, on social media, that the rich and famous seem to be able to get access to test kits very quickly and are tested. But in many instances, people who don't have the means are denied tests. How can this be fixed so that everyone has access to these tests?
Yeah, no, this is obviously a significant issue that we're having, and I will say that we all know that our country was basically unprepared for this pandemic. We know that widespread testing is necessary to curb the spread of the virus, and that specifically, in minority communities, that access to testing has even, more difficult. And so, what we're looking at right now, because the federal response has been, quite poor, we're actually looking to state and local public health authorities to really start allocating resources, especially for testing, to those communities that are being hit the hardest, and those are mostly our Black and Brown communities. And so there needs to be targeted testing in these communities. There also needs to be contact tracing, where you know who has been infected, and you trace everyone that has had contact with that person, and those people should isolate to the best of their ability to prevent the spread of the virus.
So, Dr. Blackstock, at your clinic, for instance, if someone turns up and says, look, I've been having these symptoms, that it points to me being infected by the coronavirus, how quickly would they get the test?
So you know what, because we have limited testing capabilities, we are not able to test everyone. And so the testing is reserved for those who have the highest risk of doing poorly if they were to have coronavirus. And those are patients who are elderly, people who are over age 60, those with underlying medical problems like high blood pressure, diabetes, kidney disease, or lung disease like asthma. And so those are really the patients that we reserve testing for. Unfortunately, the majority of patients are not eligible for testing according to the criteria we're currently using. And so, we basically tell them, these are sort of the red flag signs to look out for: shortness of breath, chest tightness, signs that they may be having a viral pneumonia. And we also, give them medication as appropriate. But really, it's about counseling them, giving them good education, so that if they do start developing significant symptoms, they come back to us and we're able to intervene.
Stella, the state of California has announced an assistance program for undocumented immigrants. It's worth $125 million. It will get about $1,000 to each household, and there are similar programs in New York and Illinois. But I'm wondering to what extent people who are undocumented will take advantage of this, because we know that the Trump administration has said that if anybody becomes a public charge, in other words, if they take any kind of public assistance, then they could be denied permanent residence or green cards.
Yeah, that's a really good question and good concern for that community, and it's unclear at this point how many of them will actually take that assistance. I think there's a lot of confusion about information and what the ramifications are of taking that assistance. There's probably even a lack of information that's even available to a lot of undocumented immigrants. So the ability to get the money to them and then their willingness to take it are certainly major concerns.
Dr. Blackstock, there's also another phenomenon which we've come across, and that is, and you've talked about this, African Americans and Latinos have long distrusted the healthcare system. You had a case in New York at your clinic where you saw someone and you recommended that it was a man, a black man in his 60s. You recommended that he go to hospital, but it was his view that hospitals are places where people go to die. Tell us about that.
Yeah, and so, the relationship of certain communities, specifically the Black community, to the healthcare system, is very tense history and really has developed over centuries. And so it's to the point where many of them do not feel comfortable seeking care. And they don't feel like the healthcare system, because of the history. We know about the Tuskegee experiment, and there were other experiments where Black communities were exploited for healthcare reasons. And so there is this concern that if they do go to seek care, that one, they may not receive quality care, and two, that it's almost like a death sentence going to the emergency department. So I've had a number of patients tell me that they would rather stay home with their families where they know that they're safe. And so obviously that conversation is a very difficult conversation because their fears, I agree, are valid. But if they do get to a point where they need to go to the hospital for oxygen, to be on a ventilator to assist their breathing, then they need to go to the hospital.
Stella, there's a question I have here, which is a little bit more of a political question, but I'm sure many people are asking this question, especially in this election year, and that is, do you think that this pandemic and the way this virus has spread around the country and around the world will precipitate some kind of changes in the U.S. healthcare system so that everybody gets access to good, affordable healthcare?
Yeah, that's a really, really good question that I don't think there's a clear answer to at this point. There's a lot of forces at work that, prevent that from happening or have prevented it from happening to this point. And whether this pandemic will be sort of the tipping point on the American healthcare system really remains to be seen. I mean, we're seeing now where, greater access to the Affordable Care Act would certainly benefit many communities, particularly low-income communities and communities of color, but we have seen no move by either the president or Congress to make that happen, to increase access. So whether there will be kind of an autopsy on the American healthcare system after this pandemic is really a good question, and not one that I think anyone has a clear answer about what that's going to look like moving forward.
Dr. Blackstock, you work in one of the biggest cities in the world. It's also one of the most densely populated cities in the world, and we've seen how quickly this virus spread through the city of New York. But right now, are you seeing a tapering off in the number of infections?
Yeah, absolutely. I would say this past week, I saw a definite decrease in the number of patients that we've been seeing, especially those with COVID-19 symptoms. And it's actually been quite an opportunity for us all as healthcare workers to catch our breath. So the physical distancing is working. And so I would just encourage New Yorkers and those in other cities and towns where physical distancing is encouraged to continue at it, because it definitely is working and saving lives.
Dr. Uche Blackstock, Stella Ross, thanks so much for being with us. And that is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for being with us.